All right, last week, the Chris Hani Baragwanath Academic Hospital in Soweto announced a partnership with Merck South Africa, a leading science and technology company. Now, the aim from this collaboration is to test for thyroid diseases, create awareness and educate people about treatment. So to speak to us more about this is Dr. Sindeep Bhana, who is the head of Endocrinology Department at the Chris Hani Baragwanath Academic Hospital. So nice to have you here. Welcome to Morning Live.
Thank you for having me.
All right, begin by talking about thyroid problems. I mean, it's a big issue that people perhaps don't even know that they have a problem with. So let's begin the interview then.
All right, so let's break it down. In order to understand thyroid disease, we need to know what the thyroid gland is. So it's a small butterfly-shaped gland sitting in front of the voice box, and it controls the entire body's metabolism. And it's an important organ from the time you're in utero in your mommy's tummy till the time you're an adult. And this organ can be afflicted by various conditions. So you can have an underactive thyroid, where the organ's not producing enough hormone. You can have an overactive thyroid, where it's producing too much and have consequences. And then, like any other organ, it can be affected by malignancy as well. So you can get a cancer.
Okay. But I believe, and again, according to Merck South Africa and according to endocrinologists, this is one of those, if you've got an overactive, underactive thyroid, if you do have cancer, it's one of the most treatable illnesses.
So you're quite right there. And that is why we need to, one of the problems is we don't have awareness of the thyroid condition. Because look, it must be important, because if you look at the medical aid funders, you look at government stance on it, it's one of the 25 conditions that's on the PMB, prescribed minimum benefits. And so it's easily treatable if it's identified early.
Yeah. But how many South Africans actually identify it? I mean, would you even think to test your thyroid if, for instance, you're feeling... I mean, one of the signs is putting on weight and losing weight. I mean, depending on which one you have. I mean, there are many, many signs, but do South Africans actually say, hang on, let me go and check my thyroid, or is that the furthest thing from our minds?
Well, it's not the first thing that comes to mind, both with patients and with doctors. So, world over, we're against the screening of the whole population, because that's going to be expensive. So we want to be identifying patients with signs and symptoms. And so we need to create awareness of some of the symptoms. And
Let's
like you mentioned,
talk about those. I mean, what are they? What are the signs?
Okay, so an underactive thyroid can be quite subtle. Most of the symptoms can be assigned to a lot of other conditions as well. It can be fatigue, it can be malaise, it can be hair loss, it can be constipation, a bit of weight gain, a bit of fertility issues, cold intolerance. You can see a lot of those symptoms are not specific. It's not like a heart attack where there's chest pain, and something lights up. So one needs to be aware that if you've got persistence of these symptoms, they haven't picked up anything else, they should be looking at the thyroid. The overactive thyroid is not difficult to miss, because here the patient may have a lot of other signs where the eyes are big, the patients will have palpitations, anxieties, tremors, they lose an excessive amount of weight, become agitated, and that can easily be identified. With thyroid malignancy, that may be subtle. So obviously if a patient's presenting with a big mass or bumps and lumps, it's easy to see. The GP will then obviously work the patient up and refer them to a specialist. But sometimes you can be harboring a malignancy without knowing it, because the nodules are quite small. And so unless we ultrasound patients where we pick up something visibly, it's going to be difficult to pick this condition up just on blood test.
Who's more susceptible to it? Do you find that males or females have more of a problem, or is it not gender specific?
No, it is very gender specific. It's one of the conditions where predominantly females are affected. So we know that for every 9 females affected, there's 1 male affected.
Okay.
And this is mainly because both an underactive thyroid and an overactive thyroid, majority of the causes are autoimmune. And we know autoimmune conditions are more prevalent amongst females.
How big is the condition in South Africa? I mean, is there a way of telling?
Unfortunately, we don't have prevalence data, but we certainly as an institution working towards getting the prevalence data. If we look at what's happening in the rest of the world, upwards of about 2% of the population will have an underactive thyroid, and as we get older, that increases. In terms of an underactive thyroid, that's a bit more rare, less than 1%. And then thyroid malignancy, what we do know is that in the West, the studies have shown that it is one of the fastest climbing cancers. So the prevalence has definitely increased. And like we said, we're trying to get a handle in what the prevalence is in South Africa.
Why? I mean, what makes a cancer become more popular amongst people. And suddenly, I mean, we're always talking about breast cancer. Check your breasts, make sure that you don't have lumps. But I mean, you're saying that thyroid cancer is possibly one of the fastest growing cancers.
You know, I think it's about how sexy the condition is and the awareness around it and who's behind it, the personality behind the condition.
Yeah.
And everybody's trying to fight for their little space. Prostate cancer is important, breast cancer is important, certainly pancreatic cancer. So like that, thyroid needs to find its space as well. What we do know that this is one of the conditions where 3 out of the 4 thyroid cancers, if it's picked up early, it is 100% cured.
Wow.
So the idea is to pick it up early, it can be well managed, and we've got the means to treating it.
Yeah. Well, I mean, if you've struggled with any of these signs that Dr. Bhana was talking about, I mean, really get that checked out. I mean, you get them through blood tests. Your thyroid, is that how you get it checked?
Yes, with the over and underactive thyroid blood tests, and then the thyroid cancers, it needs to be felt by a doctor.
Okay.
Yeah.
All right. And it's on obviously just over here.
Yeah, it's just over here.
And you'll feel it inflated if there is a problem. Is that correct?
You'll feel a lump or bump. Yeah.
Okay. Well, examine yourself, have a look, and like we say, this is one of the fastest growing cancers that perhaps is a little bit under the radar, and we need to get it above the radar so people become aware. Thank you so much for talking to us, Dr. Sindeep Bhana, who's the head of endocrinology at the Chris Hani Baragwanath Hospital. Let's take a break. When we return, Ayanda will bring us the news at 7. Stay tuned.